From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. The COVID-19 pandemic created challenging situations for many of us, especially for families who saw a loss of income, fears of homelessness, and having to supervise children's schooling from home. Now, for children who were already living in homes with abuse and neglect, violence, and substance use, the pandemic increased the risk of danger for them. School is usually the first line of defense, where teachers and counselors, nurses, for example, see children in person and can gauge a child's physical and mental health. Now that school is back to in-person learning, the impact of what happened to those children has become visible. April is National Child Abuse Prevention Month, and today on 22 News in Focus, we're going to be looking at what's being done to address this issue here in Massachusetts. So joining me now is Mary McGowan, the Executive Director for the Massachusetts Society for Prevention of Cruelty to Children. I want to thank you for coming on the program here, and I want to first start with that organization. Tell me a little bit about it.
I'd be pleased to, and thank you for having me. Again, Massachusetts Society for the Prevention of Cruelty to Children, MSPCC. It is a mouthful, and I know that, but I really like to point out to people that our middle name is prevention. Our best work, and it has been our best work for more than 144 years, is when we can work with families to get in there and help families be the very best parents they can be long before they're ever involved with a child service agency like the Department of Children and Families. So we provide services in Holyoke, Worcester, Lowell, Lawrence, Boston, in three sort of buckets. The first bucket is our home visiting program, where we work with young parents to help them learn to care for their children. We help them get jobs, apartments, everything they need to do to be able to care for their family, and we help them get education and jobs so that they're able to have the income to be able to support their family. We provide clinical services to children who have been primarily abused or neglected. So we're working with them to help them understand the trauma, give them coping skills so that they're able to heal. So often for a child who's been physically abused, the bruises go away, but it really is that emotional work that we're targeting and trying to help a child through. And then our third bucket is really working with foster and adoptive parents. These are individuals who step in to help kids heal. They open their homes and they open their hearts. We provide training and support to help them do it.
Well, according to the U.S. Department of Health and Human Services Child Maltreatment Report, in fiscal year 2020, over 7 million children were referred for investigation of abuse across the country. Again, that was in 2020. Do you expect to see that number go up when we look at 2021?
Yeah, so it's really interesting. When the pandemic started and everything shut down, Massachusetts saw and the country saw plummeting of allegations of abuse and neglect. Here in Massachusetts, they're called 51As. And it's for exactly the reason you just said. Children were home, they weren't going to schools, they weren't going to doctor's offices, they weren't out and about. So there simply wasn't as many eyes on them. So we saw that number really, really drop. And it was very concerning, because just at the point where you want to be able to connect with people, connect with parents, provide supports, make sure that they're dealing with stresses in a healthy way, we couldn't see them. We couldn't go into their homes. So it was very, very concerning. And so I should point out that number you just pointed out, in Massachusetts, we saw 84,000 allegations of abuse and neglect last year. That's less than we did pre-pandemic. And we saw probably of the 84,000, about 40,000 investigations, resulting in about 24,000 kids who we found to be abused or neglected here in Massachusetts. Now that number is still lower than pre-pandemic, but we have seen an uptick in the allegations of abuse. And when those abuse allegations come in, we have seen a higher proportion of them being supported. So do I expect the number to continue to go up? Yeah, I do. I think we keep saying, COVID has a long reach, and I know the virus isn't done with us, but we're going to be dealing with the impact of this pandemic for years to come. It was interesting, during the pandemic, we found that first responders, EMTs, police officers were really filing the vast number of reports of allegation of abuse. And to no surprise, it was parents who were struggling with substance use. So we're dealing with kids who may have found a parent who had overdosed, may have found a parent who have died from an overdose, and those numbers creep up. And I think that was really one of the takeaways from the pandemic, that so many people responded to the stress and the isolation by abusing substances. And, we know when parental substance use is involved, it's kids who pay the price.
And I know that with Zoom, for example, a lot of teachers kind of had for the first time an inside look into their students' homes. Yeah. So did you see numbers rise there when it comes to allegations? Maybe like teachers seeing stuff that's happening that shouldn't be happening at home?
Yeah, that's an interesting question. And even for my own staff, because remember, it wasn't just teachers in schools that went remote. Organizations like mine that do the bulk of our work by going into homes suddenly weren't able to go into a young parent's or a child's home to do our services, which was really hard for a human service agency. We rely on that human connection. And you're absolutely right. It's one thing to see a kid, but it's another to see a child in the context of the home. When it comes to abuse and neglect, the vast majority of allegations of 51As are for neglect. And that starts with, is there enough food in the house? Are the kids clean? Is the house neat? So when that type of information wasn't available to our teams or others, you really did have to find creative ways to do it. So it wasn't unusual for one of my staff to say to a kid, if they're on their iPhone or they had a laptop, show me your room. Mm-hmm. And while the child's doing that, a good clinician, a good human service provider is looking to see, what else am I seeing? Are there adults? Other adults who are paying attention? Are people healthy? Are they, using substances? Is there food? Is the apartment kept up? And I think teachers used a similar type of insight when it was available to them. But I also completely understand the challenges of remote learning. And when you talk to teachers, it was not unusual that some children weren't on the screen all the time. They weren't able to log in. It was those first few months was really bumpy to get the internet access for families, to make sure kids had laptops. So there was a lot of work in those few months to make sure that families were equipped to be able to participate remotely in education as well as services.
All right, we're going to continue our conversation just after the break. We're back here now, 22 News in Focus. Today we're talking about child abuse prevention. For nearly 150 years, your organization has provided services to protect children and has evolved to include programs for parents and families. We're speaking here with Mary McGowan here. Let's talk about this. What is the Healthy Families Program, and how do you reach young parents to get them to sign up?
It's interesting when we talk about Child Abuse Prevention Month. The word is prevention, and our goal should be that children and families never make it to the Department of Children and Families. We should be doing everything in our power to make sure that families across the state of Massachusetts are strong and resilient and have the tools that they need to keep their kids safe, healthy, and thriving. And Healthy Families is just one of the best tools available to really give parents the skills that they need to be the best parents they can be. Healthy Families works with individuals who are under the age of 24. Hopefully, while they're pregnant, we're able to connect with them and help them understand what they need to do to take care of their bodies, what they should be eating, what they should be doing, and what to expect during their pregnancy. When the baby is born, our home visitors step right in to help a young couple, and it's both the mothers and fathers we're working with. Even if they're not together, we still continue to work with moms and dads to help them understand how they nurture their child, how they take care of their child, the importance of pediatrician visits. We also make sure that they have the right supports, because we know it's really hard to talk to a parent about taking care of your child if you don't have food in the house, if you don't have a crib, if you don't have a carriage. So our staff do a lot of making sure these young parents have what they need to be able to care for their families. And then it's really helping them understand how to parent. Sadly, a lot of the young people we deal with grew up in homes without great role models. They didn't have a good mom and dad who were showing them how to play with kids, how to read with kids. That's the type of stuff that our staff are doing, and it works, because we know that if we're in there helping these young parents, they're more likely to finish school, get a job, have their own apartment, take care of their child, and that's how you end the cycle of abuse.
And if you aren't involved in this program for prenatal care, can you still get involved post?
Absolutely. Absolutely. If we ideally we're with them prenatally, but we will connect with them at any point, where you take children up until the age of 3. Recently, we've also started another program that targets a slightly older group, those individuals under the age of 26, with children up to the age of 5. And again, it's called Parent as Teachers. And it's really, again, work going in, home visiting, giving individuals the skills that they need to be a parent. But yeah, we work really hard not to use the word no. And if a family comes to us, we work really hard to find the right connection for them.
As far as fees go, do these parents need to pay? And if not, where are you getting your funding from?
Yeah, that's a good question. No, there is no fee associated with these services, and they are voluntary. And we receive funding from different state agencies. So we receive funding from the Children's Trust, which supports our Healthy Families program. We receive funding from the Department of Public Health that also supports our home visiting programs. We have really strong partnerships with state agencies, and they turn to organizations like MSPCC and others across the state to work in communities and connect with families to provide these services.
And then what about parents that have a child, for example, that may have some mental health issues?
That's a really important question, particularly when we talk about COVID. In the wake of COVID, we have seen across the board a real crisis, a mental health crisis among youth here in Massachusetts and across the country. We see more children showing up who have suicidality. Our emergency rooms are filled with kids who need psychiatric care. And when you work with a child on behavioral health issues, the only way to do it is in the context of the family. So our staff connects with the child to find out what's going on and helps them. But at the same time, we have staff who work directly with the parents so that they also learn the skills to help their child. So we do a lot of in-home therapy where you're going where their family dynamics are, helping kids cope and mom and dads know what they can do to help their child in the moment get over a mental health crisis.
And I like how you mentioned, the pandemic and how it's been impacting children, but it's also been impacting teens. Do you have programs for behavioral health services, for example, for teens and their family, maybe family counseling?
Yeah, we do. So our services are for children or youth under the age of 21. But you're absolutely right. Within that, there are specialties. We have staff who are dedicated to working with kids in behavioral health under the age of 5. So think about it, kids between the ages of 0 and 5. So important. But again, it's that relationship with the parent. So are they connecting with the parent? Are they attaching with the parent? Are the parents able to give the child the social and emotional support that they need? And then as you begin to look at latency age children, again, slightly different, right? What you do with an 8-year-old as you're thinking about school, and are they comfortable? Are they able to make and keep friends? That's a different one. Teenagers are challenging to begin with, and those teen years can prove to be very, very difficult for kids. So there are some programs that really connect with youth through schools. One of the more interesting programs statewide is a program called the NAN Project, which really works in primarily middle and high school to connect with kids by using peers. So they have young people who have experienced behavioral health issues themselves, and they go into school and talk about what it was like to be 14, 16, 17 years old and struggling with anxiety or depression or suicidality. And what you see is the difference from hearing it from now an 18 or 19 or 23-year-old who's on the other side of it, but can say, I know how you feel. You can talk about it. You can get help. There's ways for you to get help. It's a program called the NAN Project, and it really is taking on this issue in a pretty unique way.
Fantastic. We'll continue the conversation just after this. We're back here now, 22 News in Focus. And for some children, going back to their biological parents is just not an option. And while the courts do their best to keep families together, sometimes the situation is too unstable and it's just best for that child to be removed permanently. So foster homes and adoption are a way to provide a child with a safe, secure, and loving home environment. So joining me once again right here is Mary McGowan, the Executive Director for the Massachusetts Society for the Prevention of Cruelty to Children. I want to talk about the foster care system. What is the KidsNet program?
Well, the KidsNet program is designed to really provide support to foster parents. And foster parents are really unsung heroes. They are so critical to our child welfare system. If you think about it, the reason a child ends up in the Department of Children and Families is because of the abuse or neglect of a parent, the person who is entrusted to care for them. And so it makes sense that the way to help a child heal is to have a positive relationship with a caretaker. And that's what foster parents do. They are loving, they open their homes, and they also are a critical intervention to helping these kids heal. Our KidsNet program really says, what do we need to do to make sure those foster parents can do everything they need for these kids? So we start by providing training. And I mean everything from what does trauma look like on a 8-year-old or a 14-year-old or a 3-year-old. So really helping a foster parent think about what type of behaviors am I seeing that really isn't because a child's bad. Let me explain. Think about it. If you have a child who sadly every night after they go to bed and the lights are off, somebody comes into their bedroom and abuses them. Now they're removed, they're in a foster home. Bedtime is going to be really, really hard. So foster parents might find that when it's time to go to bed, a child just flails and starts to cry on the floor. Well, if that foster parent doesn't understand the connection between the trauma of being abused and the behavior, it's not that the child is a bad child or acting out or needs a timeout. It's like, this is how this child is coping. This child is afraid. This is triggering something really scary to them. So if the foster parent is trained to be able to say, how can I help this child? How can I keep this child safe? What do I need to do to get them through this moment? That's one of the best things our agency does, is help foster parents understand how to cope with the behaviors that you might see in a child that we would find puzzling or disturbing. We also provide enrichment activities. We pre-COVID, would go to have amusement day afternoons at Six Flags or Canopy Lake, where foster parents could come and kids could really just have a fun opportunity to play and be kids. We also help foster parents who are interested in adopting from foster care. We provide training around being an adoptive parent, help facilitate the match, and allow that connection to be made. How does
someone sign up to be a foster parent? And then, and also, I guess, what's the vetting process like?
Yeah, it's actually very comprehensive. When you talk to a foster parent, I think they would tell you that it's very thorough. It can take a little bit of time, not too much time, but I think they really appreciate it because this is important. These are the Commonwealth's children. They've been removed from their parent, and it's really critical that those individuals who step up to become foster parents have been vetted and they're held to a really high standard. So if you're interested in becoming a foster parent, you do reach out to the Department of Children and Families, and there's an application, and then a process begins. There's a background check, a criminal background check. There's a child welfare check. Have you ever been involved with the Department of Children and Families? Have you had allegations of 51As? There's a home safety check. They're doing everything from going through your home and making sure you have smoke detectors, that there are, if there are weapons, they're locked away. So really making sure that the home is safe. And then there's a tremendous amount of work with the individuals who want to be the foster family. What's your motivation? What's your background? What's your parenting style? How did you meet your spouse or partner? How do you two resolve issues? Are there other children in the house? What's their understanding about fostering? What are they expecting when it comes to an adult? I mean, it comes to a child entering our home. So there's a lot of questions that really get to the root of who are you? How do you think about kids? What's your parenting style? And what's the likelihood that you're going to be able to connect with kids on these levels? It's a very thorough process, and it should be.
Yeah, it sounds a little bit like therapy, actually, which I think is kind of nice.
Yeah, a little bit.
Not too bad. All right, we will continue our conversation here. Stay with us. We're back here now. We've been chatting with Mary McGowan, the Executive Director of the Massachusetts Society for the Prevention of Cruelty to Children. And we've discussed a lot of information concerning your organization. I want to just put some information out there for viewers who may be interested in becoming a foster parent, for example, or any of the other services. Where do they need to go?
The best place to go, they can contact the Department of Children and Families at their website. There's information on there. You can also contact MSPCC, and we will happily connect you to the right opportunity for you and your family.
All right. I'm sure there's some place where they can fit in. Thank you so much for coming on the program. I really appreciate it.
Thank you. Thank you for having me.
And you can find out more information about what we've been talking about as well at our website at wwlp.com. And if you've missed this, you can watch it in its entirety at our website. Have a good day.
From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. People all across the country are suffering from COVID-19 burnout. Many have sought out mental health services because of feelings of helplessness and despair, fear, anxiety, even suicide. Health providers are reporting stress and anxiety levels are reaching a crisis level in children and teens. So joining me today to discuss what can be done to reduce this growing problem is Michelle McCallion, and Vice President for Children and Youth at the Behavioral Health Network. I want to thank you for coming on the program here, and I want to talk about this because I want to know, first of all, are you seeing an increase in demand for your child and family services?
We're absolutely seeing an increase in demand for child and family services. Since the pandemic began, there's been a significant increase in the mental health, behavioral health challenges that kids were already suffering from. We've seen a significant increase in psychological distress because of the stress that the pandemic has caused, the fear that kids have experienced, and of course their families as well. And so we are seeing a lot of people knocking on our door for services that we haven't seen before.
And what issues are your clinicians seeing in an increase in need for? Any particular age group or demographic of children?
Well, we're seeing, kids of all ages and from all walks of life. However, the pandemic has really disproportionately affected youth who were already suffering from mental health challenges, and from the youth also who were already experiencing health disparities. So kids who are suffering from poverty or from parent-child relationship issues, or kids who are minorities who we know already suffer from health disparities. Those are the kids who are much more likely to need services and then not have access to them. And so we're trying to meet that demand. Kids who are low income also tend to have more behavioral health challenges. Kids who are living in rural areas suffered greatly during the pandemic because they already had limited resources in their communities. And so when they were out of school, they may have had less opportunity to access resources. Our racial and ethnic minority children are suffering greatly as well. They were suffering before the pandemic, and now those disparities have just increased significantly. So our Black and Latino youth, our Asian and our LGBTQ plus youth are really seeing an increase in demand there. And kids with intellectual disabilities, those are the kids who had services before in schools and in institutions. When the pandemic began, they were no longer able to access those services in the institutions in which they were getting them. And so they're falling farther and farther behind, and we're trying to help them catch up.
What are some of the types of services that you offer for children and youth?
We offer a lot of services for children and youth. So first and foremost, we have our crisis services. So 24 hours a day, 7 days a week, somebody can call our organization and just talk to someone. You can get in touch with a clinician or a counselor who can talk with you through a behavioral health crisis. They can come and meet with you in the community, or you can come to our offices at any time of day and receive services. We also have outpatient services, so we offer individual therapy, family therapy, and group therapy. We also have outreach services that will go right into the home and work directly with families, especially for our higher risk youth who need more intensive services. So we offer a variety of services that will help stabilize youth who are experiencing ongoing destabilization and crises. We also have mentoring services, so we have staff that will go out and work with kids one-on-one, building social skills and teaching them how to navigate really complicated peer relationships. We have a family resource center right in downtown Ware, and you don't have to be a Ware resident in order to access those services, so you can just show up during business hours and someone will be able to connect you to anything that you need. We have also a residential program for youth who are suffering from a behavioral health crisis that aren't ready to stay at home. If it's not safe to be at home, you can come and stay with us for a short time. You can get psychiatric services, group and individual therapy, family therapy, and then we'll work really closely with you and your family to help you find a plan that will help sustain you once the crisis is over.
How many children and families are involved in your programs right now?
We have about 4,600 youth that are enrolled in services, not including our crisis services.
So which ones are maybe most in demand right now?
Yeah, the most in demand, I wish I could tell you that there was one in demand over the other. Unfortunately, all of our services are in incredible demand. What we are seeing a lot of right now is the demand for those crisis services that I described. Unfortunately, there are more kids who are needing out-of-home short-term placement, such as the youth residential program that I talked about, or the hospitalization level of care. And oftentimes kids end up waiting for that either in their homes or in the hospital emergency departments because there simply aren't enough beds for kids to go into. Other resources that we're really seeing a demand for are like food and housing assistance and cash benefit assistance. Families that didn't need that before are needing that now, and so they're coming to us in order to help them connect to those services when they never had to. And then the other resource that is highly in demand is honestly the people to do the work. We are not immune from the staffing shortage that has impacted businesses across the country. And so we're really seeking to find people who are ready, willing, and able to do the difficult work that it is in serving these kids and families.
All right. Michelle McCallion joining us here she's a vice president for children and youth at the Behavioral Health Network. We're going to continue our conversation after a short break. You're watching 22 News in Focus. We're back here now, 22 News in Focus, and we're joined today by Michelle McCallion with Behavioral Health Network. And today we are talking about the growing mental health crisis among children and teens. It was back in December that the United States Surgeon General issued an advisory on the urgent need to address the nation's youth mental health crisis. The pandemic has added to an already overburdened system that was struggling to meet the mental health needs of children and youth even before. So some are turning to substance use and self-destructive behavior. So let's talk a little bit more about this, because what are some of the signs that should alert parents and caregivers that their child may be struggling?
You know, oftentimes, parents wonder, is there something going on? And what I tell folks is, if you think something is different, then something's probably different. There are certainly signs that you can look for: irritability, anger, changes in behavior, changes in appearance, less interest in activities that your child was interested in before or really enthusiastic about, and they're just finding that they're no longer interested in those things. Other changes in patterns of behavior: less sleep, less eating, or if they tell you something's wrong, right? I mean, oftentimes our kids will mention that they're not feeling well. If they're saying they're not feeling physically well, but there doesn't seem to be anything physically wrong, that probably means that something's going on. But honestly, your gut is going to tell you that something's happening and that you should ask about it.
And sometimes children will hide their feelings and tell you that everything is fine. What are some of the ways to approach your child to find out if they're struggling?
Well, first and foremost, it's really okay to ask. I think oftentimes parents wonder, should I say something? I don't want my child to get angry at me, especially teenagers who tend to kind of turn things around. But it really is, the first thing to do is just to ask the question. Notice that something is different. You don't have to accuse your child. All you need to say is, I'm just noticing something seems different with you. Are you okay? How are you doing? One really important factor to consider for parents is that we have to make the conversation about mental health a normal conversation in our households. It is just as common as talking about our physical health, getting enough sleep, getting enough food to eat, the right foods to eat. Being emotionally well is just as important. And if we can normalize those conversations, then it'll help our kids approach us and talk to us more about that. And one really important factor is to be a good role model for your kids. When you take care of yourself, when you show that your own mental health and well-being is just as important as your physical well-being, and you talk about that sometimes you as an adult struggle too, your child's going to be more likely to approach you and talk to you about that.
And isn't it true too that you don't necessarily have to make an event out of it? These conversations can happen as you're going about your day-to-day routines. It doesn't have to be, let's sit down in the living room and have a full-on discussion.
Exactly.
Yeah.
Just like I said, earlier, make it a normal part of everyday conversation. It doesn't have to be an event that you have. Ask every day, how are you doing? How are you feeling? How'd you sleep? How was school? Maybe share a little bit about your day as well. It doesn't, you're right, have to be something that's out of the ordinary. It could be just a part of your everyday conversation.
When should someone consider contacting a pediatrician or, say, a mental health clinician for their child?
There's never a wrong time to contact somebody if you feel like something's wrong. Just as if we have a medical condition that we don't want to get worse if we don't address it, the same thing applies to our mental health. So if you feel like something's still going on, even if your child isn't talking to you about that, it never hurts to call the pediatrician, call a social worker at school, get in touch with somebody who can offer you some guidance and support in order to help you, guide your children and guide your child.
And I was just going to talk about schools, like their role in all of this. I mean, I would suspect that it's a constant line of communication, keeping that open.
It is. One really important thing is to maintain good relationships with the school personnel. As a parent, we oftentimes want our kids to be able to talk to us about everything, and that's just the reality is they're not going to talk to us about everything, and that's okay and that's normal. Allow your child to develop relationships with teachers, develop relationships with school counselors or coaches that they trust and might go to, and let them know that it's okay to talk to them, and then you should develop those relationships with them as well.
What are some of the reasons that children give for their feelings of, say, depression or anxiety?
Well, the reasons kids give are really parent-child conflict, not feeling connected to their peers anymore, not feeling as though they fit into the things that they fit into before. We have to remember that the pandemic has really exacerbated a lot of the normal stresses that kids have felt for years and years normally as part of growing up. But because they have been isolated from their friends, isolated from their normal developmental activities, they start to feel anxiety and stress, and they don't even always know why. Social media can also have a significant impact on kids' mental health. They're constantly being bombarded with different messages that they have to act a certain way, look a certain way, and if they don't meet those expectations, then there's something wrong with them.
And what are some of the factors that can influence the mental health of a young person? You know, you mentioned social media, health concerns, financial instability, one of them likely, right? Safety at home, academic pressure, bullying.
Absolutely. All of those things that you mentioned. One thing that I mentioned earlier, and I can't stress enough, is that the health disparities and that kids suffer have a significant impact on their mental health. So kids who are living in poverty, minority kids as well, they already have a lot of challenges just by being a minority, and so that impacts their mental health significantly. We mentioned social media, which also can't be stressed enough. There's a lot of also parent-child interactions. If a parent isn't doing well and doesn't address their own issues, sometimes that can have a significant effect on the child's mental health. And there's just a lot of stresses because of the pandemic. So we've been living in fear for a couple of years now, and that has, it takes its toll, and kids don't know always how to deal with that.
I know that a lot of kids had a difficult time with zooming in for class, but some children who had difficulty in school or those social situations, they actually thrived during virtual learning. They got more sleep, they got more family time, less social and academic stress, I suspect. So now that they're back in school, what can parents do to kind of keep that positive momentum going and just help ease them back into that social setting?
That's right. Yeah, so there were some positives that came out of this, believe it or not. And a lot of what happened was that we were able to slow down. We weren't engaged in these incredibly, fast-paced, numerous activities that we ask our kids, sports and school. They had a lot more sleep, they were eating differently, and honestly just connecting with families in a different way. Kids and their parents had an opportunity to be able to spend more time together, more quality time together, and they found new traditions and new things that they enjoyed doing together. So keep finding those things and building on those things as you move forward, as we reemerge into the world.
Michelle McCallion, thank you so much. We're going to continue our discussion here once we return. You're watching 22 News in Focus. We're back. This is 22 News in Focus, and we're joined by Michelle McCallion. She is with Behavioral Health Network, the Vice President of Children and Youth. And today we are talking about the increase in need for mental health services for children and youth. The lack of mental health services, especially inpatient beds, has been a problem here in Massachusetts for some time now. Mira Vista in Holyoke has plans to expand their inpatient bed for adolescent care as well as substance use disorder services. Bay State Health recently broke ground on a new behavioral health hospital that's expected to open next year. So I guess my question to you, does Behavioral Health Network plan on expanding or cutting any of their services?
So at BHN, we've always been able and ready to meet the ever-growing demand in the community, and we continue to seek different ways to expand the services that we offer. Our funding comes from different sources, so from state organizations, from insurance companies, and grant-funded programs. And so we're always looking at what are the needs of the community, and are there funds that will support that need? And so, we're constantly looking, and we'll continue to do so.
I would suspect that you're constantly shifting and changing depending on where the need is. So in some areas you may need to shift things into another area. The collaboration has got to be key here. So are you looking at other organizations for partnerships?
We have numerous partnerships with other organizations, including state organizations, local hospitals, and other nonprofits. And so we're always, again, looking at what are the needs of the community and what might somebody else offer, or how can it expand the geographic area that we're serving. And so, we do that so often, and anytime that comes up, we're looking to expand that as well.
BHN offers integrated care, and I hear that word often, integrated. So what is it and who's eligible?
Yeah, integrated care is a really cool approach, to be honest. What it does is work from the concept that in order to achieve overall wellness, we have to look at the whole person. And so in order to achieve success, we have to look at behavioral health needs, mental health needs, and physical needs, and also what we call social determinants of health. Those things that get in the way of success, like poverty or a lack of services or access to services. So right now, we actually have clinicians who sit right in doctors' offices and work with the doctors to address a need right in the moment. If you're sitting in a doctor's exam room and the doctor identifies a need, they'll go get a clinician and have them talk to you right then and there. And then we'll work with you to make sure that you have the services you need on an ongoing basis. We also have care management programs that for folks who have multiple medical and behavioral health needs, sometimes it's really hard to navigate those systems. And so we partner with you right in the community, do our outreach. We can bring you to programs. We get you hooked up with services, hooked up with resources to make sure that you have what you need so that it's not just one aspect of the person, it's the whole person.
What emergency services do you guys offer?
Yeah, so we do have the crisis services. So 24 hours a day, 7 days a week, 365 days a year, you can call BHN and you will be connected with somebody a live person who can talk to you about whatever's going on. We can come out to you in the community. You can come into our offices and talk with somebody. Or you can even do a telehealth visit at this point. We also offer the inpatient or the residential program that we discussed earlier. So youth who are not able to safely remain in the home while they address a crisis, they can have a short stay with us and get psychiatric care along with individual, group, and family therapy. And then we'll hook you up with services to make sure that you remain stable.
So, like under what circumstances do you provide mental health expertise in juvenile court or even child welfare situations?
Yeah, so we are embedded right into the juvenile court system in much of Western Massachusetts, and so we've got psychologists who, on the referral of a judge, will go in and do an assessment. Oftentimes, juveniles end up in front of a judge because they've done something to break the law. But what we know about that is that they typically do that because there's a behavioral health issue or a mental health issue that's at the root of that. And so courts understand that and really want to get to the bottom of that and treat the child. They don't want to send them to a correctional facility if they don't have to. So our clinicians can do an assessment. They can work with the family. They can help them get connected to services. They can provide short-term group and individual therapy. And then they also provide consultation to court personnel on what to do with a particular case.
What's the empowerment program?
So the Empowerment Project is actually a sub-clinic that we have out of our Child Guidance Clinic in Springfield that offers services to LGBT plus and gender nonconforming youth. So kids who identify as LGBTQ plus or gender nonconforming can work with a clinician who has training and expertise in that area. We'll train our clinicians, we offer them ongoing support, and then we offer those individual services to families.
So how do parents or caregivers go about getting care for their child? Do they need like a referral, or do they just call the program directly?
You could do either or. So anybody can call and make a referral, a doctor's office, a school, a social worker, a friend. But you can just call 413-BHN-WORK, and you will get connected to somebody who will talk to you about what your needs are and get you connected to someone who can do an assessment, and then we'll find the right service for you.
And then you kind of mentioned a little bit about this, saying you get state funding and whatnot. But are most of the programs and services, are they covered by insurance?
We accept all insurances, and most of the programs that we do offer are either covered by insurance or some sort of other like state funding. If someone doesn't have insurance, then we actually have people that can help you to connect to applications, but we do have services that if you don't have insurance, we can do what's called gap care management. Offer those services for free and then get you connected on an ongoing basis.
All right, Michelle McCallion, thanks so much. And we are going to continue our program here right after the break. You're watching 22 News in Focus, and today we have been talking about the growing need for mental health services for children and teens in our region. And I want to thank Michelle McGalian from the Behavioral Health Network for being on our program and providing all the information on their services that they provide. Thank you so much. And I want to thank you at home as well. If you missed any of this program, you're more than welcome to go to our website at wwlp.com. From all of us here at 22 News, have a good day.